How do mastectomy and lumpectomy recovery times compare for breast cancer? When facing breast cancer surgery, understanding how long recovery takes can help you plan and feel more prepared. Mastectomy and lumpectomy are two common options, but they differ quite a bit in recovery time. Lumpectomy involves removing only the tumor and a small margin of healthy tissue, usually as an outpatient procedure. Most patients can expect to return to their normal activities within about 5 to 10 days. The recovery tends to be quicker and involves less discomfort because the surgery is less extensive. However, it is important to remember that lumpectomy is often followed by radiation therapy, which typically lasts about 5 to 7 weeks. This radiation can cause fatigue and other side effects during that period, extending the overall treatment timeline. On the other hand, a mastectomy involves removing the entire breast tissue and is a more extensive surgery. Recovery from a mastectomy generally takes longer, usually around 3 to 6 weeks if no reconstruction is done. If reconstruction is performed at the same time, recovery can take 6 to 8 weeks or even longer, depending on the type of reconstruction. Patients often stay in the hospital overnight or longer, and the larger surgical wounds mean more post-operative pain and a slower return to daily routines. The recovery process can be more physically demanding because of the extent of the surgery. In terms of cosmetic and emotional impact, lumpectomy preserves most of the breast tissue, which often results in better cosmetic outcomes and less impact on body image. Mastectomy results in the permanent removal of the breast, which can be challenging emotionally, but reconstruction options are available to help restore appearance. While lumpectomy has a shorter recovery period, it does carry a slightly higher chance of cancer returning in the same breast compared to mastectomy. However, when combined with radiation therapy, survival rates are similar for both procedures. Recovery experiences can vary widely depending on individual health, whether lymph nodes are removed, and if reconstruction is involved. Overall, if you are considering these options, remember that lumpectomy generally involves about 1 to 2 weeks of recovery, while mastectomy can take 3 to 6 weeks or longer, especially with reconstruction. It's essential to discuss your specific case with your healthcare team to understand what recovery will look like for you and to get personalized advice. Always follow your doctor's guidance and focus on your health and well-being during this process.